Botswana is an upper middle income country. However, the middle income status for Botswana masks a lot of inequalities that we see for children. So when we look at poverty situation in Botswana, overall 16% of households in Botswana live in poverty, monetary poverty. And there is a gender and geographical disparities in terms of these poverty numbers, where you will find that those in rural areas are more poorer than those that are in urban areas. And so these disparities also takes a gender dimension, where female-headed households are 10 percentage points more poorer compared to male-headed households. So by that alone, it then has an implication on the situation of children, because females are the most caregivers in the country. And this then affects access to services, basic services that are required by children, starting from health, immunization, education, protection, and social protection.
One of the major challenges that we are facing as Botswana is high levels of violence against children in this country. In order for us to be able to successfully implement and protect the children of this country, we are still in need of increasing the child-friendly police centers across the country. But especially we should be having police that are trained to be able to handle children's cases in a child-friendly manner, making sure that the best interest of the child is kept. We also need to still train more frontline workers. This includes our social workers, our magistrate, prosecutors, health workers, as well as teachers, as they are the first point of contact for children who are going through abuse. One of the areas worth highlighting is that we've managed to get support from different stakeholders that have managed to train over 600 police officers, and Botswana Police continues to train more. But it is not enough. We still need to do a lot when it comes to the training of the first responders.
What we've done as UNICEF supporting government is firstly supporting policy development to close the gaps that currently exist. Some of these policy development and strategies include the early learning development standards, the comprehensive ECD policy framework. We've also supported the government of Botswana work around special education and inclusion, in recognizing that there is a lack of standards in the country. UNICEF supported the government in developing the National Learner Support Standards for special education and guidance and counseling. Having done this much of work together with government, there are still gaps that exist. And what still needs to be done in the education space is improved access to early childhood education. At the moment, only 38% of children have access to early childhood education, and we know that early childhood education lays the foundation for success in a child's life. In addition, while government has done a lot around school connectivity, which UNICEF also continues to support, there is still a continued need to increase connectivity in more schools.
The other issue that we are also looking at is ensuring that adolescents and youth participate in policy and programming. We are seeing that achievements around opening and exploring platforms for youth to participate at the national level. For example, those that are supporting the HIV programs, and we see that young people are actually taking the center stage to demand programs and services that are of quality. Even though we have all of these key achievements, I must say that there are still key areas that we need support from. The HIV treatment gap is still a reality among adolescents living with HIV.